Waking up early every morning and maintaining a job can be sometimes kind of demanding. So that's why it's normal to ask ourselves, what is really the purpose of working? Of course, we have to work to earn money, but when we're thinking about it, our job brings us personal satisfaction, challenges, opportunities to build contacts, and to socialize. But beyond that, when we stop thinking about ourselves, we can notice that working is a great way to help society and to make a difference in our communities. To make difference in our society, we have to work in team and to collaborate. That's why in many jobs, collaboration is really important, and the job that I'm going to talk today is not an exception. So I'm going to present 3 situations in which the pharmacists have to collaborate. So firstly, pharmacists have to collaborate between each others. In fact, hospital pharmacists have to communicate with community pharmacists in order to ensure the furtherance of the treatment of the patient that have been hospitalized. In fact, during hospitalization, there are many medical changes. The hospital pharmacist communicates those changes to the community pharmacist. For example, if a patient has been hospitalized for pneumonia, he quit the hospital with a prescription and then he can go to the pharmacy he wants, such as Jean Coutu, Uniprix, Familiprix, or any others, to receive his antibiotics, so he's going to be able to continue his treatment at his house. The patient will have a shorter hospitalization and he's going to be able to continue his treatment. The community pharmacist will make sure that he's doing great and that his treatment is doing fine. And the community pharmacist is also going to modify the medical file of the patient. So the community pharmacist, as well as the hospital pharmacist, will be able to have a good follow-up of the patient condition. Then the pharmacists collaborate with nurses and physicians. In fact, this collaboration is essential to take good care of the patients who are receiving their entire treatment at their house. In fact, hospital pharmacists are giving their opinions about the drugs consumed by the patient, and they are talking about it with the physicians. They're also giving different advices to the nurses. For example, if a palliative care patient is receiving his end-of-life care at home, the pharmacist will make sure that the side effects of the drugs, such as dizziness or pain, are well controlled. They're also gonna ensure the patient is feeling fine and comfortable, and they can adjust the medication depending on the nurse's observations. In this particular case, the pharmacist is also going to pay special attention to the dignity of the patient. So he's going to verify that the last wills of the patient are going to be respected. So in this example, if the patient wants to die at home, he's going to make sure that the medical professionals are going to do everything they can to keep the patient at his house instead of at the hospital. Finally, the pharmacists are collaborating a lot with universities. In fact, hospitals receive a lot of students of pharmacy from different universities. The pharmacists are going to teach the students the foundation of the profession of pharmacist and how to be great pharmacists. For example, if an intern is staying in an hospital for a month, the pharmacists are going to show him or her the different sectors of the hospital, and they're also going to give him or her a lot of tools to be a great pharmacist, and they're also gonna teach them about the medical discoveries that have been made recently. At the end of the internship, the pharmacists are gonna report the strengths and weaknesses of the student at the universities, so the universities are gonna be able to help the students in their educational pathway. The pharmacists are gonna pay an attention to their medicalistness in the way they teach the students, because they are conscious that the future of their profession is in those interns' hands. Finally, collaboration, as you can see, is extremely important in the job of pharmacists. In fact, pharmacists collaborate with other pharmacists, nurses, physicians, universities, but also with a lot of professionals such as physical therapists, occupational therapists, nutritionists, psychologists, social workers, and so on. There are so many. So it's a proof that collaborating is really important to make a difference in our society, and that working in team is really important. So once again, the profession of pharmacist proves us that united we stand, but divided we fall. Thank you.